One of the most commonly requested topics that we get currently is in today's climate is how are we dealing with all of these changes that are creating some difficulties in our practices on the hygiene side. So I'm delighted that you've taken some busy time out of your busy schedules to join us, and it should be a great conversation. So let me start first by sharing my screen, and I'll introduce myself. For those that don't know me, I know there's some longtime friends here, but also some people that maybe this is your first introduction to some of the things that we teach. So let's talk through who I am, what my story is, and what do I do. I actually began my journey in dentistry as a teenager, as an assistant in a dental practice in Southern California. And from there, the doctor that I worked with said, "You would be really great as a hygienist. You should be a hygienist." And my response was, "What's a hygienist?" Right? So I really didn't have a lot of clarity of, about the profession and what hygienists do in a practice. But I soon learned, right? Then I actually worked at the front desk while I was taking some prerequisites in college. And once I graduated from hygiene school, I absolutely loved clinical hygiene, but I found that I was having some struggles, right? I learned how to be a clinician in hygiene school, but I didn't really learn a lot about the business side of dentistry and how to really maximize my own skill set to help my practice grow. So again, back a little bit earlier, while I was in hygiene school, I had my first child. My daughter joined our family, and it was a really challenging time. But so not only did I graduate from hygiene school as a fresh green hygienist, but I was also the main supporter for my little family, as my husband still needed to finish school. Now, sadly, but also amazingly, this daughter that I had in hygiene school is now also a practicing hygienist. So I tease her that she went to school twice, once in utero and once, as a fully grown human. So it's been great to share this profession that I love with her. Along my journey, trying to figure things out, I realized a few really critical lessons. And that was, why did I want to share some of those critical lessons that I learned with those in my profession? I learned that I wasn't the only one that was having some of these struggles with how do I fit as a hygiene provider in the context of my growing practice. I was also with a younger provider. And as the sole wage earner for my growing family, which, as you can see, grew beyond my first daughter, I learned some really critical lessons. And now I'm not practicing clinical hygiene anymore, even though I still love the profession. Now I feel a higher purpose, and that is to share those important lessons that I learned early on. My family's continued to grow. Look at all these amazing people, right? The grandbabies, we have 4. They don't know it yet, but they're all going to be dentists. So we're working on developing the, skill sets early on. We do the Barbie dentist and the Play-Doh dentist and all those important things. So again, as I learned some of these valuable lessons, it really helped me create a bigger future for my own family. And certainly in the past few years, as a part of the Team Training Institute, one of the co-founders of that, the knowledge that I learned early on that dentistry changes lives, and that our mission now with TTI is to really empower dental professionals to improve the dental health of the world. It's really amazing and humbling to me how far this mission has grown. We literally do work with practices, the best and the brightest, all across the United States, Canada, UK, Australia. We work with some of the best people all over the world. And what I'm bringing here to you tonight is the collective knowledge that I've learned from the past 25 years in the trenches in dentistry, as well as in the trenches in your practices, being able to see outside of my own 4 walls. Dentistry can be a very isolating profession sometimes. And sometimes we don't know what other practices are doing to solve the very frustrations that we're currently having. That's really what tonight is all about. So some of the important lessons I learned that really have become part of what we teach is that for me as a new provider, even though I found myself in a very young practice that desperately needed to increase production, I realized early on that my personal ethics and core values would not allow me, I would not permit myself to look at adding a change or adding a service simply for the goal of increasing production. Instead, what I realized is that I took really great care of my patients and did what was best for the patient first every time. Production would naturally follow that. So for many of you, I know that that's an important thing for you as well, is that we recognize that our patients deserve the very best that we can give them. And if we can all agree on that, let's do a high five or a clap or some kind of reaction. You can type yes in the chat if you like. But I just want to make sure we all agree that patients absolutely do deserve the very best care we can provide. And in spite of today's challenges, hopefully tonight you leave inspired with new ideas and a fresh vision of how we can overcome the most challenging conditions that I've faced in my career, but still do the very best thing for the patient. Okay, so that's going to be the goal here tonight. It isn't about the money. We will talk about money tonight. I'm going to share some case studies and some success stories with you because it's important to know that what I'm teaching tonight, what we're talking about, are proven strategies. These are real world solutions. This is not just theory. These are not ideas that sound good in principle, but when we go to apply them, don't really have an impact in our practice. That's not how we operate. You know, for us, it isn't about the money, but we recognize that dollars currently are how we measure how well we're caring for patients in dentistry. I wish there was another way to measure it, right? But that's how we measure it. We look at production, collections. We look at those things as a part of how well we're providing dentistry. So we look at our day sheet at the end of the day, it's loaded with all the services that we provided throughout the day, right? So just keep that in mind that for me, production was never really the goal, but it is how we measure how well we're caring for patients. So that's enough about the intro. Let's dig in, right? I've got a lot prepared to share with you about these challenges and how we're seeing other practices succeed in spite of them. But also I wanted to have some time for Q&A at the end. So as we go, if you have questions, we will invite you at the end to unmute, ask your question out loud. If you feel more comfortable typing your question in the chat, you can do that at any time. And we will try and answer as many of your questions as we can tonight here on this webinar. Okay, so many of you have joined tonight because we want to have a bigger future than what we've been able to accomplish in the past. And I would say that patients want the same thing. But in recent months, we've had some pretty unique challenges, right? So I would be curious to know from some of you, what are the biggest hygiene struggles in your practice? You know, I know what we often hear, the common struggles, but what are some of the things that you all are struggling with right here, right now? And again, you can type it in the chat if you like. You can also unmute and just say it out loud. Usually when we invite you to do that, it's not sheer chaos. Not everybody has the confidence to just unmute the line and share their challenge. But if you'd like to, you're welcome to. And I'll keep my eye on the chat here as we see what are the biggest challenges in a practice. And of course, I have to wear my glasses. So I'm seeing not enough hygienists, cancellations, okay? A couple very common challenges. Anybody have anything else they want to add to that? I'm guessing there's going to be more lack of hygienists and assistants, difficulty hiring and retaining and attracting people into our amazing profession, which is quite sad, honestly. Retaining our providers, okay? There's a few elephants in the room that no one has had the confidence to mention yet, but don't you worry, never you mind, I'm going to bring them up. Insurance, there we go. There we go, insurance is a big one. Dentists, only wanting to do surgery. So dentists being highly specialized, even though they have a GP practice, creates some challenges for some of us. I get that. Okay, insurance as well, another one. Okay, true knowledge of what a talented hygienist does. Okay, that's fair. I think you know, there's a lot of different opinions about what that looks like, and I'm going to share with you my definition as we go. Convincing patients to do services they need. The example used here was fluoride, but what about all preventive services or even restorative services that they really would benefit from? You know, underutilizing codes, growth, being able to fuel growth. We hear from practices that they have been growing at a rapid clip, but then all of a sudden they hit a road bump and maybe they become stagnant or they're starting to see a slow decline. Okay, that's a very common thing that we hear. So thank you guys for sharing those challenges with us as we go. Again, it's important to me that you get good value out of your time here on this webinar tonight. So good news is I already have a lot of those common struggles built in. Okay, so I can tell you that in all my career, in all of the history since the late 80s, if you can believe it, working in a dental practice, I have never seen a greater divide between doctors and the teams, between hygienists and the team, between the doctors and the hygienists than I have seen right here, right now in the last few years. It's been really, really challenging. And I'm going to not hold back from addressing some of the reasons that I see looking over data and talking with thousands of practices. Every year, we get a really well-rounded view of the current state in dentistry. So if I were to ask you, what are we all looking to accomplish in hygiene? Almost always, we're going to say we would like to have a profitable hygiene department. Again, keeping in mind the lessons of we're not going to do it for the production only. We're going to do the very best care for the patient that we can. What does that actually look like? And then we also say, okay, what are the reasons we're struggling there? And the most common challenges that we hear is we end up with a prophy palace. And I'm going to explain that to you. What that means is we're seeing a trend in dentistry where the appointment times are being shortened down and the expectations of the hygiene team are ever growing. So we're seeing a high rate of burnout, right? So that's the common challenge that comes when we end up with a prophy palace. Okay, another very common frustration that we hear, a common challenge is that the wages in hygiene have grown significantly in a short amount of time. Now, in some markets, that was a necessary wage adjustment. But in other areas, it's becoming a little bit unsustainable for many of these practices. And I think it's important that we discuss that because that leads to our difficulty hiring. It leads to our difficulty with retention. Okay, so we're going to talk about that as well. Another challenge that was mentioned was insurance. A lot of insurance fees are really low. And even though we've seen record pace with inflation and costs are through the roof, unlike many businesses, we can't just raise our fees if we're participating with insurance. And so it creates a real challenge for us on profitability. Okay, so these are the most common challenges that we hear about. And certainly we're going to expand those challenges because there's several that are kind of tied together. You mentioned retention, you mentioned attracting hygienists and retaining hygienists, you mentioned insurance. There's a lot of the challenges that you expressed that we will be covering in greater detail as we go throughout our time together. So let's talk about the prophy palace first. And I mentioned that this trend is about shortening appointments down, right? And I think it requires some brutal honesty about how we got to this place, right? So I love to share real world scenarios with you. We talk about these a lot. So here's an example. Just got a new job, 50-minute recare and perio maintenance appointments, 50-minute new patient appointments. Here's all the things that we need to do in that. 50 minutes of scaling and replaning for 2 quads. I've been a hygienist for 9 years and never had such short appointments. I see about 6 patients in 5 hours. I'm feeling worked to death and always rushed, right? There's all these other things that we have to do as well. Okay, that is, in my world, a definition of a prophy palace, where we're expecting our hygiene team to be on a hamster wheel and really get patients in, get patients out, shortening those appointment times. Here's another example. I need your best response to the office manager telling you to do a perio maintenance in 30 minutes, as in the patient is scheduled for 30 minutes. Still have to do blood pressure, health history, update, reappoint, scale all those teeth. How do we do that? What's our response there, right? Some examples of prophy palace scenarios. Walked out of my job today. I work assisted hygiene with 2 other hygienists. All together, we worked 6 columns. We had 1 assistant that we had to share. I brought this up to management, begging for more assistance, and was told no. Work environment was toxic. Life is too short. This is one of the things that we're seeing. The prophy palace mindset, the thinking that we have to shorten appointments down and cram more patients through, is part of why we have a shortage of hygienists. It's part of why we can't retain and attract hygienists. It's part of why hiring a hygienist has become so difficult, right? So how did we get to this place, right? Why are we seeing this response? Why are we seeing practices go down this path? And to me, I think we need a greater understanding of how profitability is calculated in dental practice. Now, some of you might be thinking, I'm a hygiene provider. I'm a dentist. We don't really get a lot of education and training on the business side. We understand that. And that's why this profitability formula shared with us by our friends at Dental Intel is so brilliant, because it's simple. Because of its simplicity. We take the number of visits times the production per visit times the collection percentage minus the overhead. And that's how we come to profit in a dental practice. Okay, so practices that end up focusing on shortening the appointments down, they've instead chosen to focus on the visits component of that profitability formula. Okay, that's why we see things like today I had an interview with a corporate company. They said I'm going to work 8 to 5 in 2 different offices, and I'm going to see 10 to 11 patients in a day without an assistant. Like, that's the focus. That's where they're choosing to play in that profitability formula. And I can tell you, in the short term, you will see profitability rise. You'll see production rise. However, in the long run, it's actually more harmful to the practice. We not only have difficulty retaining our team, but we have difficulty retaining patients. And this is, in my opinion, a damaging strategy. Instead, we choose to focus here on the production per visit. Now, we still focus on the number of visits by minimizing the churn in the schedule. Somebody mentioned that cancellations is a problem. We're going to talk more about that in a bit. But instead, we focus on the production per visit. And what I love about this as a hygiene provider and someone who's fiercely committed to my patients is that in this part of the formula, we can still provide quality of care. We're choosing to focus on the quality of care we provide rather than the quantity of care we provide. Now, efficiency still matters. Utilizing a schedule effectiveness still matters, and we'll talk more about that. But when we focus on production per visit, what that means is we can actually expand the care we provide in the time that we have. Okay, so solutions for the common challenges of profitably, burnout, difficulty retaining providers. Some of the things that we've learned, one of the core solutions that we teach is to improve our effectiveness. Okay, now you might be thinking that's pretty vague. How do we improve effectiveness? We have a variety of systems that we have created and we help practices implement that help us improve our effectiveness. One of those systems is to implement a risk assessment process as a part of every hygiene visit. Okay, another system is we maximize 3 roles of hygiene. World-class hygienists. One of you said it's difficult for hygienists. That was one of the challenges to know, like, what makes an excellent clinician, what makes an excellent hygienist. This is a solution to that frustration, maximizing 3 roles of hygiene. And then a very key and strong focus on patient experience. That is also an important part of the equation. Okay, so let me dig into each one of these briefly. Okay, when we talk about risk assessment, how important is this? Well, this is the World Health Organization. And they say that chronic diseases and injuries are the leading health problems in all but a few parts of the world. The rapidly changing disease patterns throughout the world are closely linked to changing lifestyles, which include diets rich in sugars, widespread use of tobacco, increased consumption of alcohol. And they go on to say that oral disease is highly related to these lifestyle factors. So for any of us that have been in the trenches for a number of years, and I see a few people that probably have, maybe similar to or a longer time spent in the trenches than myself, right? We know who we are. I can tell you that over the years, the risk profiles of our patients have changed dramatically. Patients of today have a lot of risk. They don't come in saying, hey, Wendy, I need a higher level of focus on preventive therapy, but they do come in saying, no matter what I do, I brush, I floss, I always tend to have a problem. Bad teeth run in my family. I do everything you tell me and I still have a struggle, right? These are the patients that need risk assessment desperately. They have products and services, products and beverages and habits, if you will, that are taking them backwards. If we can, we need to help them balance the scales of risk in their favor. How do we outweigh all of those highly damaging risk factors in patients' lifestyles? Well, we do that by a stronger focus on preventive therapy, which is what dental hygiene is all about, right? So that's why a systematic process for risk assessment is so critical. Here's an example of a part of a tool that we use and we help hygienists employ. It's a risk assessment survey. Okay, and this is adapted from the ADA. It's a very quick and easy tool. We say 90 seconds or less as a part of your appointment is what it's going to take you to actually fill out this tool. And it helps patients understand why they need the services they need. Somebody mentioned one of the challenges was having patients to accept care, like fluoride. Once we do risk assessment, guess what happens? They understand not only why they should have those procedures, but they really appreciate our attentiveness and our care that we're providing them. I've had patients tell me, no one has ever helped me understand why I always had a struggle with cavities, right? They really appreciate that insight. Then we move on to 3 roles of world-class hygiene. Now, I could teach an entire webinar on just these 3 roles, but tonight we have so much more to talk about, right? But when we work with hygienists and we help them understand, what is a world-class hygienist? What are the roles that we need to be embracing? How do we do this in the limited amount of time that we have? It always comes down to these 3 critical roles: preventive therapist, periodontal therapist, And then dentists get really excited about this one because very rarely do we see much training on this at all. But the role of a hygienist as a patient treatment advocate really in supporting our doctor's restorative philosophy. How many times do we have patients that once the doctor leaves the room, looks at us and says, what do you think? Do I really need to do that? How long can I wait? If we're truly maximizing our role as a patient treatment advocate, patients no longer ask those questions. It's a systematic process that we're employing throughout the practice. Everyone's on the same page, speaking the same language, and helping patients understand why they need what they need. Those are all really critical, important roles. Now, when it comes to patient experience, this is probably one of my favorite things to speak about and to talk about, and that is patient experiences need to be world-class, right? I love this book by Will Guidara. It's called Unreasonable Hospitality. And we have an entire training, a full day training that we do based on some of the principles in this book. And if I had to summarize it, I love this quote: the way you do one thing is the way you do everything. And we found that precision in the smallest of details translated to precision in the bigger ones. So when it comes to a world-class patient experience, we created a list. We have a 65 touch points in a world-class patient experience. And we encourage you to rate your practice on how you're performing in each one of those touch points. Precision in the smallest details can make up for it. It translates to precision in the bigger details, right? So when we talk about patient experience, we talk about increasing performance. All of these things add up to make a big impact right away. Now, again, I love to provide proof of some of the things that I'm sharing with you this evening. So I'm going to share with you some case studies as we go. This is Dr. Nguyen and his hygiene team, an amazing hygiene team. He knew he had untapped potential. And you can see in the first 30 days, they've already seen a significant improvement, right? And it's because they focused on risk assessment, having higher level conversations with patients about fluoride and some of the other preventive services that would really benefit them, right? It's because they understand they need to maximize their 3 roles, and they really focused in on providing a world-class patient experience. It doesn't take long to see a pretty powerful impact with some of the strategies that I'm sharing with you here tonight. So we're very proud of his progress and his hygienist progress. They're doing amazing things. And it doesn't take very long, again, to see that level of impact. Again, almost a $30,000 bump in the first 30 days. We love that. Let's move on to the next challenge. Okay, again, I want to make sure that we have time to answer questions for you. So let's talk about the elephant in the room. Let's talk about the high hygiene wages. Let's talk about what that means to our own profitability. Okay, difficulty with hiring is also a challenge that comes from that. So I would love to see you rate yourselves, rate your practice. In your area, in your practice, how big of a challenge is high hygiene wages, difficulty attracting hygienists? If you wouldn't mind, rate yourselves in the chat, red, yellow, or green. Red means it's a struggle, it's a serious problem. We have been trying to hire, our wages are out of control. Yellow, we're probably in the middle of the pack. We've been hiring, we've been able to find people, but we're not sure. Sometimes we end up hiring like the least worst out of all the applicants that apply. Green, fully staffed, rock star team, not much of a challenge. Wages are comfortable. Okay, so let's just get a quick sense of where everybody rates themselves in this issue. I'm seeing red. I love the honesty. Red, red, red. Like that wasn't just one red, that was a triple red. Red to the 3rd power, okay? I'm so glad you're here because we're going to be talking about some ways beyond that.